I think we are just beginning to see what the future of health information exchange and, more importantly, being connected really means. I am not nearly smart enough to know all the things that can happen, but I do know that we are sitting right at the edge of a very monumental time. And I think physicians, hospitals, all providers, given those kind of tools in this position, in this time, I think the things that we're going to see in the future are going to be just earth-shattering. Care coordination is the future of medicine. For too long, we have practiced in silos. So bringing information to the doctor or to the healthcare team is the most important thing that health information exchanges do.
As a patient is discharged from a hospital, it's very easy now for a primary care doctor to know that that patient is being sent home, and for the care coordination team that the doctor works with to have a care plan in place that really makes sure that that patient has adequate food, has adequate transportation to their primary care visit, make sure that they actually have their medications or have the medications beyond the time that the hospital sent them home with. Because oftentimes it's those social, environmental kinds of issues that cause our patients to readmit back into the hospital. If we can notify the doctor, if we can notify the care coordination team that the patient's coming home and that there really needs to be people around that patient to ensure that they have a complete understanding of their care regimen, then it's much more likely that that patient's going to have good health outcomes.
I think the future is going to rely to a great extent on whether the provider community, physicians, hospitals, other providers, are able to leverage the immense potential and power that is contained in real-life clinical data, the data that comes through health information exchange. It is going to transform the way they practice medicine. It has great potential for improved quality. It has potential to reduce the growth in cost and expense. It has the potential to allow providers to collaborate more effectively in a team-based care environment that will benefit all patients.
It's very important as we're looking forward in the next 5 years for organizations to really start thinking in a very proactive way about how they're going to be able to actually stay in business in this new healthcare market. So the recent announcements from CMS that they will be moving to have 50% of all of their payments be associated with value-based payment models in the next 5 years is a significant driver of the need to build health information technology and the infrastructure that's going to be necessary for that. The real-time clinical data that's coming out of our hospitals and our physician practices is the data that's going to make the difference in the health and wellness of our patients, as well as in being able to reduce the overall costs that the healthcare system is incurring.
Long term, the ability to provide actionable intelligence, analytics, that will assist providers in not just improving quality, meeting the quality measures, but also lowering the risk of adverse events is of great value. In our business, what we find is that many of the same issues that become part of the quality metrics also are some of the largest risks from a professional liability standpoint. The ability to assist providers in increasing and meeting those measures has a direct impact on then lowering malpractice risk.
It's very hard to predict with any certainty what's going to happen in the next few years, but one thing is certain. Now that the door has been opened to data, that door is not going to be closed. It is going to be how clinicians, physicians, hospitals, other providers working together. It's going to be how the provider community chooses to use that data to improve care, reduce costs, all the things that we believe are the positive benefits that will come out of it.